When I think about this conversation with regards to cost of government or with regards to where we're going with our expenditures and our budget, I'm really interested in how we integrate all this information so that, HHS would have a set of criteria and or goals that, are towards, of course, well-being and healthcare, access, et cetera. And every other department would have their set of goals, but ultimately, if we are making budgetary decisions that are aligned with each of those goals, then we would be able to move the needle not just on healthcare, access of goals, but for example, the issue of the achievement gap, right? So all these disparities should be moving if we had an across the board, I think, system that we can then evaluate for impact, for return on investment, et cetera, but it's completely aligned. And I just worry that at least when we have our budget discussions, it would be great if we had budget come forth in each of the committee and it also cited how this is aligning, how is aligned, with all of these issues that you just raised. Because the school system keeps telling us that they still have, problems with students that show up, right, affected by all of these issues. You can talk about housing overcrowding, access to healthcare. So I'm wondering if there have been efforts to not just, for example, meet with those who are in the health space, but also with the school system, et cetera, to have that comprehensive and very well aligned, system, so that, again, when I raise my hand for a particular budgetary item, I know that this is what's having the best impact and that it's tracked across the board. We do have to think about the whole notion of workforce development, the academic achievement gap, but then when you talk about the academic achievement gap, you have issues that are related to health, that are related to, overcrowding, et cetera. So it's all very connected. And I guess what I'm hoping is that we get to a point where it's so seamless that basically in every policy area that we have to make, decisions, whether it's legislative or budgetary, that we are incorporating this information front and center. So it helps us make the kind of decisions that are going to be most targeted, because oftentimes what we're doing is that we're looking at things separately. Once in a while we look at the data around farms, and we look at the data around, demographics or things like that. But oftentimes we don't. We have these conversations, total isolation with the population that supposedly, has the most need, and then we wonder why we're not getting the results that we expect, or how come it's taken 10 years, et cetera. So I guess what I'm saying is that, and I haven't formulated that yet, but I'm hoping we get to a point where all this information that I keep hearing about in different arenas, whether it's this update, whether it's when we talk to the school system, that we can integrate that in everything that we do, so that when it comes down to the bottom line in terms of budgets and expenditures, we understand that it's being targeted most efficiently and not just kind of losing track of everything because we continue to make these decisions in isolation.